Hello, Imprints Cares families. This is Ashley Long, one of the assistant directors with Imprints Cares Expanded Learning. Thank you for your patience. We did our Zoom town hall meeting last week, and we had a lot of questions regarding some of the precautions we're going to be taking for summer camp. And we really wanted to make sure we gave you accurate and good information on that. So we've been working on that this week. So again, thank you so much for your patience. I have Sarah Baker here with me today. She is a pediatric nurse practitioner, primary care with the School Health Alliance. Imprints Cares has made this really awesome partnership with the School Health Alliance. They are great partners in our community, and they have given us a lot of guidance on a lot of the questions you had. So me and Ms. Baker are gonna run through some of these questions that you guys had and address that. So.
All right. Well, hello, everybody. So I'm so excited to be working with Imprints and to be working with all the kids and during this crazy coronavirus time. Talking with Ashley so far, I'm very encouraged about the plans that Imprints already has in place. They've already been doing a lot of things that is recommended by the CDC. But some of the questions were excellent that the parents asked, starting with, will the students and staff need to wear face masks? So right now, it's recommended that cloth face coverings are worn for students and staff when feasible. And so there's times when you do not wear a face mask, and that would be like children less than 2 years old, or if they're not able to take it off. Anybody that has a hard time breathing, respiratory conditions, things like that. If you're 6 feet apart from people, it's okay to have the mask off. So you can have a little bit of breaks. When you're eating and drinking, you're going to have the mask off. We just want to have that extra barrier for safety, okay? So, and it is a cloth face covering.
Sorry, and Sarah, sorry to interrupt you, but I just thought of something. What about outdoors? If a group and a staff person are outdoors, what are the recommendations for wearing masks?
So when they're outdoors, again, if you are at 6 feet apart, you don't have to have the mask on, which is nice.
Good.
Yeah.
Okay.
Okay, so then they ask, how long should a student or staff be without fever before returning? That's a great question. Again, this is an answer that is a case by case. Okay, so first, you would want to refer with your doctor. You want to ask your doctor, hey, this is what's happening, and let them guide you. There is specific advice, though, for people who think they've been exposed to COVID or know they have COVID. And there's 3 questions you have to answer yes to. Has it been 10 days since you first had symptoms? Have you been without fever for 72 hours without taking any medicine for fever? And are your other symptoms improved? You have to say yes to all that. So, but again, there's specific guidance for that, okay?
Perfect. And one question that we had is, and a concern that parents have, which is valid, is students sometimes can be asymptomatic where they might not be showing symptoms but could be carrying the virus. Which for us, we deal with a lot of kids. So, how can families feel good about sending their kid to camp with these kind of worries?
Yes, okay, so that's where the guidelines that you've been putting into place are working, and that's where you're trying to practice social distancing as much as possible, meaning you're keeping the same children in a group, right? We may have a different teacher come in throughout the day, but we're trying to keep the same children in a group. We try to be 6 feet apart. A big thing that y'all are already doing, you're screening everybody at the front, okay? So you're asking them, do you have a fever? Do you have a cough? Any shortness of breath? If there's a positive to anything, they can't come into the building. So you're trying to make that building the safe place. The other thing is encouraging hand washing, sanitation. We're cleaning everything. Y'all have a program for disinfecting everything. We're using the type of cleaners recommended by the CDC and approved. And so these are all things that we're trying to do to prevent spread. So,
Right.
Yeah.
And I'll interject a little bit too. And Sarah, I don't think I told you this. We actually, our rotations happen about every 30 to 45 minutes, which means staff and students are washing their hands between every rotation. So every 30 to 45 minutes, we're washing hands.
Yeah, that's wonderful.
And each one of our staff members who are leading a group will have almost like a sanitation bag that will have some type of disinfectant cleaner, paper towels, and hand sanitizer. So between those activities, They're going to be wiping down equipment. They'll be wiping down doors, anything that anyone comes in contact with, their hands or things like that. And we also have created a position for our summer camp called the facilities manager. And that is a split shift between 2 staff members. So that means there'll be a facilities manager on campus during all operating hours. So somebody that comes in right before students come in at 6:30 and is there almost till after 6 o'clock. And their sole purpose is to sanitize general spaces, wipe down tables. Mealtime is going to be very important for them to clean tables before and after each meal we have, so breakfast and lunch. And it's their sole purpose is to be at camp and to be that person that's wiping down and being accountable for that.
Yeah, that's wonderful.
Mm-hmm.
And it's great. I love that the teachers have their own little bags.
Mm-hmm.
Okay, let's see. They asked some people, let's see what was next. How should we handle if a student or staff begins to show signs of COVID? And so then again, you want to refer to what are the signs of COVID, and y'all have that everywhere, I'm sure. Fever, cough, shortness of breath. Children may be asymptomatic. They may also have vomiting or diarrhea. But in kids, you might see fussiness, chills, shivering, flushing to their face, headaches, not eating or drinking. So if you see these things, the first thing is we want to isolate, right? We want the kid to be taken to a room with a caregiver, and we want them to go home. Staff member, if they're sick, we want them to go home. And then the child, we're going to refer the parents, we recommend you take them to the doctor, and then we'll go from there. Staff member, same thing. We'll go from there.
And we have been very lucky as an organization that other partners we have in the community have made adult size masks and children's size masks. So each one of our camp will have a supply of child size masks for if a student starts to show signs that this student will be isolated into a special area, that they are not around anyone else and monitored closely by a staff member, but they will be given one of these child size masks as well.
Yeah.
So,
Yeah, and then remember too, like there are several things that cause a cough that are not coronavirus. So what you're doing is extremely precautious. It's wonderful. But again, you could isolate that child, put the mask on them, they go home, they get tested, it's allergies, yay, everybody's happy. But it's just extra precautions we're doing to keep everybody safe.
exactly.
Until we know more, okay?
Yes.
But that goes along with the question, if somebody's sick, do we need to tell everybody? And the answer is no. When there's symptoms that somebody has, we don't know what's causing that yet, okay? So, but when we do know there's a positive case, a confirmed case of COVID-19, the first thing is the health department needs to be notified, and then you will discuss with the health department. They'll guide you, and decisions will be made. They may want you to close down for a couple of days while they get the contacts and trace it and things like that. They may not. It's going to depend. But that's the only time that everybody needs to be notified of these sorts of things.
Right. Okay. And just to clarify that again, so if a student or a staff member tests positive for COVID at one of our campsites, the first thing we will do as Imprints is contact the health department. They will give us all the guidelines, and then we will contact all of the staff and families that are at this site. And we don't know what that would look like for the camp. We only can follow what the health department guidelines give us. And I think like Ms. Baker said, it's going to be case by case if they can trace it quickly and we can nip it, things like that, or it might take a little bit more time. And we're just going to follow whatever guidance the health department gives us.
Yes, and we keep people anonymous. It's just the message that goes out is there's been a possible exposure to COVID-19. But again, the health department will guide all of that communication and everything. If that were to happen, hopefully it won't.
Right. And we've been, I think we're in the 11th or 12th week of our crisis care, and we have not had one outbreak or anything like that. So I know I don't even want to clap for myself. I want to clap for my teams that are in, on the ground. They're the ones that are doing this daily. And so very, very proud of our staff who have been taking this seriously and doing what they need to do. So
yes, you should be.
Fingers crossed.
Yeah.
So it's been good.
Awesome.
Okay. And I'm trying to, oh, and one thing I just wanted to mention too, you know, water fountains are gonna be closed at the schools. We're gonna, again, the facilities manager's responsibility is gonna be we have big water coolers that if you've been with us with Imprints, we normally take those on our field trips. They're gonna be on site at our campsites for the kids to fill up their water bottles, and we're gonna have cups, you know, available for kids to fill up water. Being hydrated is a big one for Imprints at summer camp. If you know us, it's hot in the summer, and we really encourage those kids to drink a lot of water. So
Yes.
we're going to have those water coolers filled at all times, and that's going to be part of the facilities manager role as well. And I'm trying to think if there's anything else I want to make sure our families know. Again, this to all of our families, and I know Miss Baker will back me up on this. This is such a fluid thing, and it's been scary for a lot of our families. It's been scary for us as an organization because our safety and health is the biggest priority that we care about.
Yes.
And we're doing everything we can, you know. But again, you know, us for Imprints as summer camp, we have fun. Summer camp is fast paced. We're going to be rolling just like normal. You know, the kids are not going to be virtually exposed during summer camp. It's all going to be person to person, you know, interaction, because I think the kids have really missed that since
Yeah.
they've been in school. And we're going to have fun this summer, but we're also going to be safe.
Yes.
And things might change in the middle of the summer if we enter into new phases.
Yes.
We're even purchasing big old tents that we can put outside to create another shaded space. So maybe one group will get to eat lunch outside one day, because we're only going to have 30 kids maximum in the cafeteria at one time for meals. We're going to have staggered meal times for the kids. So that way we can social distance and we can do all these things to keep the kids safe, but also have fun.
Yeah.
Um,
Because that's very important too. The fun is very important. The mental health, that's the thing you have to make decisions of, you know, one, is this essential? Yes, the child care, what y'all are doing, it's an essential service. We need you to continue doing it, but doing everything in your power to keep it safe, and factoring in the mental health. And so I love that because the kids are going to have fun, but they're going to be safe, you know,
yeah.
so it's perfect.
Yes. And if you don't know already, for crisis care, we've partnered with School Health Alliance, and they've been doing lessons with our students, and mental health has been a big focus of those lessons for the students, of coping skills and how to manage this stressful time and
Yes.
things like that. So, you know, we're really going to take that into account for summer as well. I think that's all that I have. If we, again, families, if anything changes or we have more information, you guys will be the first ones to know. So I just really, really appreciate your patience with us as we navigate this crazy time. And I really want to thank Sarah and the School Health Alliance for being with us and partnering with us and kind of going along this journey with us. So
Our pleasure.
thank you so much. So, all right, families, we'll see you soon.
Bye.